Howdy! No, I am not Dolly Parton. Get ready with me. Let's talk about homozygous FH. So there are two forms of FH. There's heterozygous and there is homozygous. Remember I told you that ideally you'd like to have your LDL, that's the bad cholesterol, under 100 milligrams per deciliter? Well, people with HoFH typically have levels between 400 and 1,000. Yes, I said 1,000. Now, someone gets HoFH by getting one FH gene from each of their parents. That's a super simplified explanation, not because I think you're dumb. I would never call you dumb. You're a beautiful, majestic mermaid, and don't ever forget that. It's just simplified because genetics are complicated, and the easiest thing to say is, yeah, you got one from each of your parents. It is estimated that only 1 in 300,000 individuals have HoFH, which qualifies it as a rare disease. You can tell she went to the pool this weekend. Her freckles be popping. If HoFH goes untreated, you can see people develop heart disease in their teenage years. Sometimes that can happen as early as 2 or 3 years old. I personally know children who have had to have open heart surgeries before puberty because of their HoFH. You start treating HoFH with a lot of the same medicines that you use to treat heterozygous FH. See my video about medicines for that. I forgot a step. Well, we'll just soldier on. There are some treatments, though, that are specifically designed for people with HoFH. First is apheresis. Apheresis is a procedure that's usually done every 2 weeks. During the procedure, the patient is hooked up to this machine that clears the LDL, or the bad cholesterol, from their bloodstream. The whole thing takes about 3 to 4 hours. And if you think that's time consuming, there's actually only about 60 apheresis machines in the whole country, so the likelihood that you live near one is low. Meaning a lot of these patients spend a good amount of time in the car on their way to their procedures. This means kids miss school and adults miss work. It is definitely a pain in the tuchus, but this procedure can save their lives. There's also a pill called lamidopide and an injection called evinacumab that are also specifically designed for people with HoFH. Recently, the Family Heart Foundation published a study in the Journal of the American Heart Association taking a look at the state of treatment of HoFH individuals in America. They pulled their data from 2 different databases, so stick with me on this. First, they took a look at data from the Cascade FH registry and found that the children in the registry had higher LDL levels than the adults. I really need to get my eyebrows done. The median LDL level, that's the middle level, for children with HoFH was 776. For adults, it was 533 milligrams per deciliter. The story that this data tells us is that it's very likely we are only catching the most severe cases of HoFH in childhood, meaning we're finding the kids with levels at 700, but we're not finding the ones with levels at 500 until they are adults and have likely already had a cardiac event. Yes, that means heart attack and stroke. So then the Family Heart Foundation took the characteristics of those in the Cascade FH registry, and they used them to look through the Family Heart database, which contains the anonymous data of 87 million Americans. And from there, they were able to identify 277 Americans who likely have HoFH. The median cholesterol levels for those people was 444. Only 26% of them had an FH diagnosis, and 20% of them already had heart disease. And the part that seriously blew my mind, you guys, is that the moment that they were enrolled in this database, 40% of them weren't on any lipid-lowering drugs, not even a statin. 40% of them were on no medicine. I want to tell you stuff when I'm doing this, but I can't talk like this. This part is not cute. All of this tells us that America is missing those with HoFH. I could do a whole other video on why that is, and honestly, I probably will, but I would like us to focus on how we fix this. One very important solution is universal pediatric screening. Lindsay, what the hell does that mean? So currently, the American Academy of Pediatrics recommends that everyone have their children's cholesterol checked between the ages of 9 and 11. Now, if you are somebody who has a history of FH or early heart disease in the family, it's recommended you have them checked at age 2. But that research from the Family Heart Foundation shows that those guidelines are not being followed. If we're not catching HoFH until they are already in their 20s and having heart attacks, then we're not checking them at a young age. And that means we're losing valuable time. My sweet little nuggets, there are treatments available for people with HoFH. It was only a couple of decades ago that an HoFH diagnosis meant you probably weren't going to live to see 30. That's not the case anymore. We can help these people. We just need to find them. And that gives me hope. All of you also give me hope, so I wish nothing for you but the best chicken nuggets.